Hello, my name is Shawna Kleinfelter. I'll be doing a 5 to 7 minute information speech on medical marijuana. I just want to thank my friends for coming out and listening to my speech and taking time out of their day. I'll be going over 3 main points about medical marijuana. First is what is marijuana and how it affects the humans. 2, when it became illegal and why. And 3, the legalization of medical marijuana in the trending states. So as most of you know, marijuana is the most popular, global, and widely produced drug in the world. Marijuana, also known as cannabis, is a plant and is intended for use as a psychoactive drug or medicine. THC is one of the 483 different compounds of the plant. When THC reaches the brain after inhalation or ingestion, it induces relaxation and typically heightens the senses and relieves pain. It can affect one's motor skills and causes paranoia and anxiety. This leads to the reason for cannabis becoming illegal. So way back in the early 1900s, just after the Mexican Revolution, there was a lot of immigration which led to the new Americans bringing in their customs, cultures, and languages. So one of these cultures and customs was the cannabis that they used. And it was used as medicine and a relaxant. Most Americans were unfamiliar with the word cannabis and did not know it was the same thing as marijuana, which was a plant that they already had in their medicine cabinets that they were using over the counter. In order to keep tabs on the new citizens, they decided to demonetize the cannabis, which also led to them demonetizing the immigrants. Yes, the excuse to detain, deport, and search Mexican immigrants was marijuana. It unfortunately was very successful, and in 1937, the Marijuana Tax Act was put into effect. This banned its uses and sales. So years later, after it was ruled unconstitutional, it was replaced with the Controlled Substance Act in the 1970s. After 26 long years, California was actually the first state to approve marijuana use for medical purposes, which leads me to my final point about medical marijuana being legalized in 28 different states, including DC. California's Institute of Medical issued a report that basically said, THC, which is found in cannabis, has therapeutic value. It's a pain reliever, it controls nausea and vomiting, and it can also be an anxiety reducer to some people and can give them a euphoric feeling. To reflect on the cannabis controlling nausea and vomiting, this can also help patients going through chemotherapy, because a side effect of chemotherapy is often nausea and vomiting. Another benefit that was reported from the multiple sclerosis patients saying that the marijuana reduced spasticity. This is also known as muscle tightness, and movement is difficult. The committee also found moderate evidence that cannabis helps with sleep deprivation, decreasing weight loss, in people with HIV or AIDS. Due to the increase in appetite and relieving symptoms from PTSD, that was also another report that was done. There's obviously some criteria, intensive research, and comprehensive programs that need to be followed before anything becomes illegal in any state, but I believe medical marijuana should be an option for any patient that could benefit from it. After seeing family and family friends go through the cancer treatments or any other disorder or illness that they may have, it would also be nice for them to be able to give any relief to the horrible side effects. Thank you for listening to my speech about medical marijuana. I hope you learned something from it. And do you have any questions, comments, or concerns?
I have a question.
Yes.
What policies do you think should be put in place so that medical marijuana can be legalized everywhere?
I think they should go through, I think they should look up records maybe in the states, and if there's a lot of drug use in that state, I think that should be put on hold, and they should do more research on it before they allow that to be legalized, I guess, if that makes sense.
Do you believe that marijuana is a gateway drug to other drugs? Is that why it is not legal?
I think it could be a gateway drug, just because some people use it as a recreational drug, but I also think it could be very beneficial to people that have certain illnesses, like I said, cancer, PTSD, HIV, but yeah, I do believe that some people do use it as a gateway drug. Any other questions?
No?
Okay, thank you.
Thank